Hello, everyone. We're glad you're here with us for On Course with Liberal Arts. Today's topic is COVID-19 in Latino communities. It's my honor to introduce you to our panel moderator, Dr. Deborah Parra-Medina. Deborah is the inaugural director of the College of Liberal Arts Latino Research Institute, which is poised to become a national leader in research and policy about issues affecting Latinos. And now I turn it over to Deborah.
Thank you, Angie. I appreciate your invitation to participate in On Course, and it's my pleasure to be here today to share a little bit about the Latino Research Institute. As you mentioned, I direct the Latino Research Institute, which is one of 3 units that form Latino studies in the College of Liberal Arts at UT Austin. Our mission is to support and produce interdisciplinary scholarship that informs policy and actions that will improve the well-being of Latino communities in the United States. We generate research and data that's vital to sustaining healthy, productive, and just environments for Latinos by working closely with community partners and activists and policymakers to turn research on topics like immigration, women's and mental health, and education into practice. In our approach to research, we recognize that health is not only shaped by biology, but also social determinants, such as housing, livable wages, quality education, etc. We use an intersectional framework. This framework focuses on how multiple social statuses, such as race, class, gender, and ethnicity, interact to shape human lives and produce a broad range of unequal outcomes. For example, the experience of a Mexican-American teacher that lives in South Texas will be different from that of a Puerto Rican nurse in New York City or a Central American immigrant that works in meat processing in rural Iowa. Yet, most traditional biomedical research would lump these people into one group and label them as Hispanics in the United States. And this is problematic because this approach masks the underlying inequalities that influence people's abilities to lead healthy lives and fulfill their human potential. At the Latino Research Institute, we focus our research then in a specific time and place, and our methods privilege the knowledge and experiences and perspectives of those who are most affected by the issue that we're trying to address. And then we use that knowledge as the starting point for our research that seeks to inform solutions to support more equitable outcomes. As we celebrate Hispanic Heritage Month, we should take note of the importance of ensuring everyone has the opportunity to achieve their best health. The coronavirus pandemic has reminded us that we have a long way to go in that regard. This spring, when COVID-19 hit, several researchers affiliated with the Latino Research Institute who were already investigating a variety of health inequities in Latino communities mobilized quickly to integrate questions about COVID-19 into their research studies. The Latino community has been particularly hard hit by COVID-19, accounting for more than 30% of COVID-19 cases nationally, and more than 74% of work-related cases, as many Latinos are employed in the service industry and as essential workers. Add to this fact that Latinos have the highest uninsured rates of any racial and ethnic group in the United States, limiting access to health care services and testing. The Latino Research Institute then brought together these researchers to form a consortium that focuses on documenting the COVID-19 experience in Latino populations. And today I've invited some consortium members to share with us what they are learning in their research. So it's my pleasure to introduce our panelists today. We have Dr. Luz Garcini, Assistant Professor, Center for Research to Advance Community Health at UT Health San Antonio. Dr. Sandy Magaña, Professor, Steve Hicks School of Social Work at UT Austin. Dr. Nelly Salgado de Snyder, Senior Researcher and Professor at the Instituto Nacional de Salud Pública in Mexico, and a distinguished research fellow at the Latino Research Institute, and Dr. Maggie Rivas Rodriguez, professor, School of Journalism, and director of the Voces Oral History Project here at UT. So let's begin. So Maggie, why is an intersectional approach so important to understanding the complex nature of COVID's impact on Latino communities?
Thank you, Deborah. The Voces Oral History Center was established in 1999 to interview people about the World War II experience. So it started off looking at Latinos of the World War II generation, and intersectionality has always played a major role in our oral history interviews. Because we're not just one thing. You can't look at one Latino and have one package. And it's not only true for Latinos, it's true for any person. We are a multitude of characteristics within ourselves. So for COVID-19, for instance, some of those factors might include educational status, it'll include occupation, it'll include citizenship status. And all of those play a role in how COVID affects them. So for instance, we have interviews with people that are construction workers who are undocumented, and how they've been affected is they're afraid to seek medical help, and they're worried about what the illness is going to mean for their families. They're still maintaining ties to Mexico. They still send their remittances in every month. So that's one aspect of it. But then on the other side, you have faculty members at universities, and you have healthcare workers, doctors and nurses, and other people. The effect on them is very different. So we can't just have a cookie cutter approach. We have to look at the individualities of each person and look at the different factors, and then try to parse out how the COVID-19 is affecting them on their individual level, and how are you able to connect the dots between all of these different factors. So it's wonderful to be, if you have just one person who is an undocumented construction worker in Phoenix, that's just one story. But if you're able to connect that person's individual story to a construction worker in the Northeast or in Florida, then you can start to see connections and relationships between how their own individual experience is shared by other people. I just got an email this morning from someone in Maine who says they want to partner with us. We're partnering with 11 different institutions, and in Maine they have a very small but an affected Latino population. So it's so important to look at all these individual experiences and then try to connect the dots between their individual experiences and the larger picture.
Thanks. So Sandy, how does intersectionality play a part in your current COVID project?
Thank you, Deborah, for the question. And actually, it really plays a large role. Currently, we're doing a study of Latinx families that have children with intellectual and developmental disabilities. And so children that have Down syndrome, autism, or intellectual disability, and really trying to understand their health behaviors and their health outcomes, and how to have healthy weight and reduce obesity among the population. And before COVID, there's definitely an intersectional approach to this study, because we know that Latinx children tend to have higher rates of obesity than non-Latinx children. We also know that children with intellectual developmental disabilities have higher rates of obesity than children who don't. So, but nobody's looked at that intersection, like what happens with the kids that have both an IDD and are Latinx and have that family background and context. So the intersectional approach is already built into this study. I mean, you could think about disability in general, like disability in the disability studies world. People of color and Latinx people are left out. And then if you think about within the Latino community and research on Latinx populations, disability is left out. So that makes them invisible, which is the whole idea of intersectionality, right? Related to COVID, so we know that actually people with disabilities experience more harsher effects from COVID, and we know that the Latino population does as well. So again, that intersection is just exacerbated for these families. And we're doing interviews with families and asking them how it's impacting them, not only in their own family life, but also on their nutrition behaviors, their exercise behaviors, things like that. And we're finding that most of the families who have responded have said that they are actually using food banks to supplement their nutrition. Food is very different now because there's not the routine of kids going to school, having meals there, coming home. And so some families are saying it's, they're not able to really have a good control of the dietary intake of the family. It's a little less structured, right? Other families are saying, no, this is nice because we're all sitting down at the same meal. So you might have some positive impacts too. And then with physical activity, first of all, kids with disabilities don't have a lot of opportunities for physical activity in the schools. They're often left out of the PE programs and so on. But they do have some. So now they're home, those opportunities are less, and the parents are worried about that. So those are some of the impacts on these families.
Thank you. How about you, Nellie? Can you tell us a little bit about your study and how intersectionality plays a role in your study? You're on mute.
I'm sorry. Yes, of course, Deborah. Thank you for inviting me to be part of this panel. And yes, about my particular study. Well, let me just briefly start by saying what was the purpose of this research project. My project had the purpose of evaluating the well-being and mental health status of healthcare workers who provide services to immigrants and to other vulnerable groups, such as the disabled, the poor, unemployed, and among other vulnerable groups during the COVID-19 pandemic. So we conducted this study using an online survey with service providers affiliated to 2 national organizations of healthcare providers working mostly in community health centers. So in my study, what we're trying to do is to understand the well-being of these service providers and to respond properly to the mental health needs of these health services providers. What we say is serving the underserved, and yet who is tending to the needs of these health service providers. In this particular project, we already have some preliminary data, and I can share with you that most of those who responded to our online survey are women, are Latinas, and are married. They have a graduate degree. And as Deborah mentioned in the introductory remarks, this is an example of the multiple roles and identities that a person have. This is part of the intersectionality approach, in which the only way we can really understand our findings, our research findings, and not only that, but respond accordingly to the needs of health service providers to strengthen their own mental health and to provide whatever they need to do their work. This approach is very, very important. So these multiple roles of identities, being a health service provider, but at the same time, being married with children. And we know now that some of these service providers, they don't even get home in spite of the fact that they have a family. They are responsible workers. and they isolate themselves voluntarily because they are afraid to bring the virus home. So there are so many issues. There are so many factors that are very complex. And the only way we can really understand what is going on is through this lens of intersectionality. Otherwise, we would be missing the details and we would not be able to respond to this very highly complex situation that is also somehow determined by the daily life that people live. So that's my study. Thank you.
And Luz is actually not at UT Austin, so she comes from San Antonio at UT Health there at the medical school. So Luz, how does what is the impact of participating in a consortium like this one? How does it impact your work, and how does it maybe improve its quality or breadth? Can you share a little bit about that in terms of joining this consortium and working with other researchers?
Absolutely. Well, first of all, thank you for the invitation, and it is an honor to be part of this group of researchers across interdisciplinary fields. It almost feels like a family, pretty much representative of the Latino culture. I think, well, for example, some of the studies that we're currently conducting are embedded throughout South Texas in communities to find out what are some of the barriers and facilitators that are influencing Latino behaviors in terms of seeking help for COVID-19, engaging in prevention practices. And as I hear my colleagues talk about intersectionality and what are some of those things that make these different Latino communities, unique, and what are the specific barriers that these communities face, or, how do we make it work for everybody? It's also important that we bring our different perspectives, because at the same time that we talk about it, we can find similarities. And why is also a core similarity despite our differences important is because that is the way in which we can maybe frame interventions to push forward in prevention efforts, right? And I think one of the things that we have found among all of us and among all of our work is the fascinating resilience that we're seeing in the Latino community. The relevance of the collectivistic values. For example, my ability to learn from Maggie, as a historian, or from Nelly at the forefront of working with healthcare workers, is like, what is behind our motivation to overcome COVID and what we're facing? And I think it's that collectivistic spirit that if I do my best to make my loved ones and those around me be okay, I'll be okay, we're gonna be okay. And I think we need to listen from different perspectives to be able to find that commonality that will be helpful to inform how we're gonna get out of this. So at the same time that we identify the differences, we find the similarities and we make a blend together. And I think for that, this is why this consortium is so unique and so different in the way we work and we approach the work we do.
Yeah, so are there any other observations that some of the other panelists might have in terms of where our research goals come together, or maybe where they are unique or independent of one another?
Well, I'm sorry, did you want to say something?
Yeah, go ahead.
So early on, we asked, our oral history project is a partnership of all these different institutions, and we were having weekly Friday morning at 11 o'clock meetings to get everybody on the same page. And there were also briefings and training. So we were having training on how to advance our research and make our questions a little bit sharper and improve our process. So we asked Nelly to be one of our presenters, and she just enriched the conversation so much. And from her talk, as she was talking about mental health issues and how they affect people during COVID-19, that really did help us reshape and revise, modify the questionnaire that we're using for everyone. And it was so valuable that then after that, I saw that that other people were saying, well, we need to have this other person because we need to. So Nellie really was the one who put us on that path to realizing what a great resource we have right here in our midst, and how wonderful it is to be able to count on one another to give us that perspective.
Yeah, as the director of the Latino Research Institute, I kind of feel like I was sitting at the center, and I have connections with each of you, which are in different places on campus, doing different kinds of research. And when I began to see that you were all focusing on some COVID-related research, and each of you had a different approach or a different population, I just saw the opportunity to come together and learn as a community, and maybe give more richness and meaning to each other's work. And so I'm excited about how we're coming together. I know we're a fairly new consortium, but beginning to establish more collaborations, and as some of our data is beginning to emerge, I know some of us actually are beginning to look at that data. So what role, for the Latino Research Institute, one of our important values is that we conduct research to, discover new knowledge, but it's important for us to put that knowledge into action, right? So what role do we as researchers have in creating solutions for what we're experiencing right now with the COVID pandemic?
Yeah, if I could jump in on that one.
Sure.
One of the things we're finding, so we're recruiting for this study now, we're interviewing people as we go. They're very extensive interviews, and we involve the child as much as we can as well. We ask them to wear activity trackers, and so it's a very involved process for families. And our community partners are asking us for tips or anything that we can provide that we're learning from our research as we go, that we can provide to their organizations and to the families. And so I thought this group would be very helpful in that. For example, just thinking about what are some things that Latino families can do at home in terms of increasing physical activity, or what are some things they could do to protect themselves. And many of you guys are studying a lot of this in terms of ways that families work together to protect themselves. So I could see where I could learn from this group on how to do that, because we are going to develop an intervention a couple years down the road based on the descriptive data that we collect, but hoping that the pandemic's over then, but we don't know. But in the meantime, our partners are asking us for real infographics or briefs or, tips or things like that they can use. And so that's something that will benefit the community right away about their experience with the pandemic. So I could see this group really helping maybe think about that for each other.
Nellie, what would you say in terms of the role that researchers have in creating solutions? How do you think your study will contribute to resolving some issues that have emerged?
Well, yeah, thank you. I think that, I think we as researchers, we have a big responsibility, huge responsibility, I will say, because as we collect data from people, we ask them questions, we have the responsibility not only of, tell them what is going on, but also come up with solutions, or at least try to contribute to improve their living standards, Latinos or no Latinos, just in general, researchers, public health researchers, we have that responsibility. How could we contribute? Well, I say that, again, this lens of intersectionality is very important, and also the role of this consortium is extremely important, because it will allow us to discuss very complex problems, our findings, we will have findings there, but they will make no sense unless we discuss them from different perspectives, and the possibility of discussing our findings, our research findings, with colleagues from other disciplines with different methodological approaches, analysis, ways of looking at data different, will help us to enrich what we already have and provide with the answers to our community. I think we have, as I said, a big responsibility, and that responsibility should be reflected in the work we do. Not only, publishing or putting a research paper together and getting it published in a good journal, but also establish those, liaisons with the community. And this is something that I can see evolving from this consortium. That civil responsibility that we have as researchers and responding and being able, first of all, to identify what are these problems and discuss them, enrich them with the collaboration of other researchers, and then go back to the community. I'm a true believer of, getting the information back to them, preparing fact sheets, policy briefs for people to read, and not only remain at the level of, publishing a research paper, but go beyond that. We need to deepen our understanding of what is going on. How could we possibly, for instance, one of my own interest is how we provide health literacy to the Latino community. How could we do that, especially, now with COVID-19 and having, the opportunity to work with health service providers. One of the major issues is how are we going to get these people to get a vaccine? How are we going to go with the community and talk to them and inform them and educate them about health so that they can make the best decisions for their health, for their own and for their own family's health. So vaccination to me is like a major issue. And of course, mental health problems is something that is already here as part of the COVID, pandemic. And we need to respond to this right away and to get ready for this.
So another, I guess, perspective, right, that we have at the Latino Research Institute is, we study inequalities. We know that there's a disproportionate burden of disease, such as COVID, in Latino populations. But we also focus on an assets orientation or an assets-based framework, right? Because there's not only need, right? There's a lot of good things that are happening, and how can we leverage those? So, Luz, what would you say are some of those assets that you are beginning to see in the Latino community that might be able to be leveraged to, work against or prevent some of the negative outcomes of the pandemic?
Thank you. Thank you for that beautiful question, because I love talking about resilience, and what makes the Latino community so unique. And we hear all the time about the Latino paradox, immigrant paradox, when despite facing so much socioeconomic adversity and stress, Latinos keep having better health outcomes, and we still need to disentangle the pieces of what that means. But I think there is so much that we can learn from the Latino population in terms of resilience that can easily be applied to other populations, to even other ethnic or racial groups facing chronic illness, that is important to emphasize. So for example, some of the things that we have found in our research in seeing how people are coping with COVID-19 is a lot of behavioral and cognitive strategies, such as, for example, behavioral activation. What I mean by that is our ability to keep busy, to find activities whether it's work, whether it's gardening, whether it's painting. How can I keep myself busy rather than dwell in all of the stress of what's happening, right? Our ability to restructure, to cognitive restructure our realities, to think about it in a more positive way, like call it optimism, call it a sense of hope, but our ability to think beyond the problem and the circumstance and say, we're gonna fight this, you know, we're gonna come on the other side. I just need to learn to ride the waves. And the way in which they do this is through a lot of creativity, you know, a lot of thinking outside the box. It's like, well, you know, and one of our participants one time told me, well, if the door closes, I'm going to look for a window to get out of the problem. You know, and I think that describes our people so well. You know, our ability also to rely on social support. And that has been a tricky one, right? Because the changes in the social conditions that we're facing, you know, the need for socially distancing ourselves has taken a toll, I would say, on the Latino community. But we are so good at reinventing ourselves, you know, and finding ways to continue building our social networks. And I think that is something fascinating that we're going to dig a little bit more deeper when we listen to Maggie's stories, you know, and what she's finding. Another thing that I find fascinating, the sense of cultural pride. You know, unfortunately, as you know, our Latinos communities have been stigmatized and marginalized lately. And a lot of the way in which we can fight that is through building a sense of cultural pride. So a lot of us in the work that we do, I feel we're trying to build that, to give it to our future generations, that this is the way we come out of a crisis, and we might be on our knees, but we always get up. So it is such a joy to be able to learn from all these different projects and studies. To make, you know, a bigger source of Latino pride.
Thank you. Yes. So, you know, I know our research is ongoing. You know, one of the major issues, I think, from the community perspective, looking into academia and research, is that it takes a long time, right? Our studies are going to be 2 to 3 years long before we have that intervention or the results or outcomes. So what needs to happen right now to provide relief to these communities? You know, we're in the middle of the pandemic. There's discussions about flu season coming up and what impact that might have on our communities. So what needs to happen right now to provide relief to the Latino community and other communities that are experiencing this disproportionate burden of COVID?
Deborah, if I could, I want to speak to that, but also to something that Luz said, because one of the things that we asked in our study is what are unexpected benefits of the current pandemic and social distancing situation. And many of the majority of families did say family, you know, having more interaction with their family. But a couple of things that parents said, one mom said that she had more time to work on personal hygiene, dressing, and grooming with her daughters, which is very important for kids with intellectual disabilities. She's been able to give them more time to work on these skills and gain independence. And then another one said that they're having better eating for their children because they're able to eat better food compared to school food. And she's been able to take her child on nature trails and learn how to bike herself. And this really speaks to what Luz was talking about, just kind of reinventing yourself and creating opportunities. She has been able to do a lot of work at home, like cleaning and decluttering. And also, instead of vacations, they've been able to take road trips, and they sold a car they're not using. So these are things that she felt were benefits to her, you know, as a result, and her family. But I do think that we could learn a lot right now from even the little data that we're getting, you know, little by little, I think, to try to help share with other families some strategies. You know, I know people have talked about, you know, getting the shot, the vaccination, and also getting the flu shots and all that. And what we notice with our families is that they're on Facebook a lot. So there are a lot of Facebook groups focused on disability and Latinos, in Spanish. And so, you know, I think across any issue, there's a lot of that. So maybe we could use, as a consortium, we could use these platforms to sort of get out to families some information that could be valuable to them.
Yeah, any other ideas from the group in terms of how we can convert our research into action? or what could the audience, I know there's people listening to us today, you know, what message could they take home and maybe act on to help address some of these issues we're identifying?
Well, I think this is something that I probably mentioned before, but I think we need to reach out to other Latinos, you know, like us, and provide them with support, with information. I'm a big believer of, you know, if you have the correct information, you're going to make the right decision. So if we just also, you as researchers, we are agents of change as well, but in the community. So we can transform our researchers and transform ourselves, and not only, you know, from an office in an institution, but also out in the community. Try to make that change and reach out to our own people. I'm a big believer in that, and that we really need to go back to the community and give them information, provide. I think that this idea of, you know, giving the brochures, whatever information, perhaps some small talks or something, so that they can make the correct, you know, the proper health and informed decisions for their own health. So we are not only researchers, but we are also community agents of change.
Thank you. Any other additions?
Yeah.
Yes, I love that, Nelly. You know, I think, sorry for interrupting you, Maggie, but I'm just so excited hearing my colleagues talk. You know, and I think this is the beauty of this consortium, right? The energy that motivates us. But I would say, you know, following on what Sandy and Nelly said, I think we need to rebuild the trust. We need to rebuild the trust in our communities. Unfortunately, there's been a lot of confusing and inconsistent information. And this is where this consortium is unique, because I think our communities trust us. Our communities trust in the work that we do and that we're doing for reasons that is going to get back to them. So we need to find better avenues to build trust within the current sociopolitical environment that is particularly challenging. And also we need to build access. You know, and by access, I mean, we need to create a workforce that is ready and competent culturally and contextually to meet the needs of our communities, that knows what it takes to be in the fields, to do this kind of work, helping our people, as Nelly mentioned, health literacy, how to navigate the healthcare system, you know, with these multiple intersectionalities that we're facing. So Maggie, I'll give you the floor, but you know, I think there's so many things that we can do to make a change, and we're making it at the LRI.
Thank you. Maggie?
So, the Voices Oral History Center is, you know, it's a little bit different from what you all do, but what we've always done since day one is we've always shared our work with the community, the larger community. We've always had public programming. That's just an essential part of what we do. So we will at some point, and I would like to have this in person, we will have some sort of symposium, and it, you know, hopefully maybe it'll include the consortium, however, but there will be some sort of public event at which we share the research that we're working on and some of the interviews, and give people an overview of what we've been doing. It's not exactly a policy part of it, but it does, and people seem to really enjoy watching that, because what we're trying to show them is the interviews that we're doing are going to end up in things like journal articles and in books, but there's another part that goes into it, and that's kind of creating a consciousness about what the community is going through. And so if we can kind of reflect back on them, we've seen it over and over again, people start to look at their own experiences in a little bit of a different way. And they start to, I think, appreciate how they fit into the larger picture in a different way. So we will be doing that.
Yeah, and you know, definitely, you know, part of being a member of the consortium, we're hoping that the Latino Research Institute can support in creating different types of collateral material, you know, supporting, like you said, public events, fact sheets, policy briefs to kind of help support scholars to get their messages out. So thanks so much for participating in the panel.
What is the general sentiment amongst the Latino community with how to protect themselves? And do machismo stereotypes play a role in how they view the situation in regard to masks and hand washing?
Anybody specifically want to try that one?
Just general.
I don't know right now if there's any specific studies that have addressed that question specifically. I think it's more that the messages are not getting to people rather than the fact that I will appear weak if I do not wear a mask. But the fact that they don't, one, have access, it's not required at work, the policies aren't in place to support it, and they don't, not understanding exactly how the virus is transmitted, so not understanding the level of risk based on the type of activities you do, and having a limited options and choices in certain environments. So I would say that the social environment and context probably has more to do with shaping that than necessarily the cultural value of machismo.
Thank you. What health providers are included in your study? Does it also include lay healthcare workers?
That's for me, I assume. Yes. Yeah, what we have actually the largest group of health providers that we have are community health workers, people who go out there who are in direct contact with people. And we also have nurses, physicians, anyone who would be affiliated to one of these two national organizations. But yes, a large number of them are community health workers, and they are the ones that we also need to work with because they are our voice, our contact also with the community. Yes, so we, as I said, it's a range of health service providers, including community health workers as well.
Thank you. I believe this one is for Luz, but maybe someone else can jump in as well. Is UT Health involved in your work in terms of helping get the word out to the Latino community of Austin?
Well, I think that's where the consortium takes place, right? I mean, we belong to different organizations, but when we come together, I think that's the beauty of having a unified front like the UT system, and different collaborators. I mean, I collaborate all the time with people in UTRGB, in Austin, in Houston. So I think this is what makes this consortium so unique that we put a forefront, we do projects like this where it's just not what UT university or city or system, but it's the entire system that is making a difference. It makes it so powerful, and it makes such a big impact in a Latino community in a state that is predominantly Latino. So absolutely, yes.
Great. Will information shared with the Latino population help influence them to register to vote and encourage them to vote in support of candidates who seemingly understand and want to tackle this situation? That was not directed at anyone in particular.
Well, I mean, I think one thing we know, right, is one thing I mentioned with the Latino Research Institute, right, is that we look at the specific history, the time and place, right? So what we're seeing happening with the pandemic is different in the United States, in Europe, right? In China, where in different countries have different systems and have responded differently. In the United States, we don't have a unified national approach. So every state is doing something different. Every city is doing something different. So, and it's really based on, leadership and the policy decisions that they're making. And so every community is gonna have a different experience different resources available as a result of this lack of common infrastructure and policy. And so I think that what needs to happen, of course, right, is influencing the decision makers through the vote. So definitely there are efforts to mobilize the vote. And this would definitely be one of the issues, I think, that gets people to the polls. So I think that, that social political environment that we're in is really going to shape people's responses. And I believe that the pandemic is going to be a motivating factor in people's actions related to the election in the fall.
Thank you.
I wanted to add something there, and this is related to the fact that I've been on top of the news and what's going on, election tonight, the debate, and all of these interesting things. And what is very unfortunate as a public health professional is that a public health problem such as, and major health problems such as the pandemic, COVID-19 pandemic, has turned into a political issue. I think that is so sad and so tragic, not only in the United States, but also in Mexico, and many other countries. Politicians somehow have used the numbers and have used the unfortunate, outcomes of this pandemic for political gains. And I think that is very, very sad. And we can see that, very clearly reflected, for instance, in our Latino community here in the United States, and other groups in Mexico as well. So I think we need to keep things where they are. COVID-19 is a public health problem, and we should be tending to it, from a public health perspective, regardless of any political affiliation or party or whatever it is. I would like to see that, but I think it's almost impossible because it's such a major issue that definitely has to have some political implications as well. I just wanted to add that. Thank you.
I can make a comment also, in that regard, and the relevance of what Nelly, you just mentioned, that yes, this is a public health issue that should transcend, right, any political divides or social divides. But for example, one of the leading efforts that the Reach Center that has undertaken, at UT Health San Antonio, is also linking it to the census. Latinos need a lot of education as to why is it important that I count, and we have taken a very active approach in helping explain people why it's important that they count and that they respond to this, because that is based on the allocation of resources, and the allocation of funding to have priorities in our communities. So I think there is a way to link it without having to be too political and start making little steps for educating our people to give a voice, because our voices matter. And it's empowering our communities to have that voice that for many of us, particularly we talk about underserved immigrants, haven't happened. And this is a lot of the times why migration happened, right? Because their voices have been taken away. So it's kind of giving back that sense of your voice counts. And through your voice, we can make these health and social changes that are so needed. So I would say it's the beginning of moving in the right direction.
Yeah, and a reminder again that change is slow, and these issues were driving our research before the pandemic, right? We were already working on these issues when the pandemic presented itself. What it did is, I think, make more public and apparent, right, these issues that were underlying these in our population and our society and what they were experiencing. So it kind of brings them to light. And this is just another model within which to address these ongoing issues. And they'll continue beyond the pandemic as well.
Thank you all so much. The next couple of questions I'm going to direct to Deborah, and then you can, offer to anyone else that wants to jump in. With the disproportionately high numbers of COVID cases in Latinx communities, have you been able to identify specific barriers to access health equity in the pandemic and beyond?
So, I mean, for example, there have been policies related to the CARE Act, right? So there are resources that are being distributed to help people economically through the pandemic. But yet issues like having a partner who's not a citizen then limits your ability to gain those resources, right? We're seeing it with respect to education, the disproportionate access to internet, and families that aren't able to receive or participate in the education of their children to the same extent as others. And then things like not having access to insurance or being in fear of accessing services due to your immigrant status. Now, viruses don't care, you know, if you are an immigrant or not, and it's not going to prevent you from getting the virus and spreading it to others. So from a public health perspective, right, we need to send our messages across. But what's going to happen is the other sorts of issues, of course, now are things like employment. You know, Latinos have disproportionately lost jobs, and in sectors where some of those jobs aren't coming back. So there's going to be a long-term impact on the social and economic well-being, because the recovery, I think, is also going to be slower for these communities. So I think that doing this research in real time is really going to help us understand and document these experiences, right? So in future, when we find ourselves in similar situations, future situations, that will be better positioned to address them. So yeah, there's lots of inequities built in to our response to the pandemic itself.
Thank you. Questioner says, I understand that with the support of Dell Medical School, Austin has seen a slowed spread of COVID amongst those in our community who are without housing. Is there a plan to extend this type of care to those in the Latinx community who are undocumented?
I am personally not aware of specific initiatives, right? I'm not saying that they aren't out there, but we can take some examples from other crises or natural events. So for example, when we have hurricanes and there's evacuations and there's places where people can go and stay when, like, evacuation centers. Many times Latinos won't either hear the message, evacuate, or participate in those resources because of fear that, you know, they have a mixed status family, that there'll be deportation, or that if they use a public service, it's going to limit their ability to complete their immigration process. I mean, there's so many factors in fear, and we've seen these things happen in other crises, and we're seeing them again in the pandemic. So I don't think it's unique in that regard. So part of it is making the community aware of what is available, and ease some of those anxieties about what it means for them personally and their families if they do partake in these services. So it'll be important in particular for vaccination efforts, for us to start thinking right now, what are we going to do to reach this community when the vaccine does become available, so we can ensure that everybody has equal access to this prevention measure.
If I could just add, the question was to Del Med, right? And Del Med is not necessarily represented in this panel, but I would like to invite Del Med to partner with us on a response, you know, to this community that's being impacted disproportionately. I mean, we'd be happy to work with them on it.
We do have one scholar who is in Dell Medical School, but is on our panel today. But yeah, I mean, I think also if you look at, I think UT has had a positive response. I think if we compare what's happened in some other institutions, we're in week 3, I don't know if we're in week 4, and we've managed our infection rates pretty well as a campus, and then in Austin as a city, right? And so it shows what planning and, letting, public health guide decisions can do for outcomes, right? But you know that these are not the same things that are happening in other communities. So really looking at places where we have success and then seeing what we did and how we can implement those in other environments and settings is important.
Great. So last question for you, Deborah. Can you share a few of the Latino Research Institute's research priorities and project in these last 2 minutes that we have?
Wow. Well, there's several research projects that are undergoing right now. One of them, of course, is supporting this consortium and the COVID research that's going on, focused on Latinos. Another initiative we have, it's called Bridging the Gap. And this focuses on implementation science. What happens is researchers spend a lot of time developing programs that work, or what we call evidence-based strategies. But for some reason, these evidence-based strategies don't make it into certain communities, or they don't work in communities, or communities don't have the assets or infrastructures to take advantage or leverage these strategies. So Bridging the Gap is really focusing on how do we take evidence-based strategies and get them into practice so that communities can benefit. So we have a variety of researchers who are involved in taking, say, for example, parenting interventions and seeing how we can translate those into Latino communities to improve parenting practices. Or how do we get best practices, say, for example, in implementing HPV vaccination in clinical settings so that we have equal adoption of initiation and completion of HPV vaccine in Latino communities. So there's a program that's really focusing on how to translate evidence-based practices into community. And then in terms of health issues, we have a large portfolio of mental health researchers, people who work on related to access to mental health services, stigma related to mental health services, Latinas and depression. We have some researchers who are looking at the impact of being in detention and how that impacts your psychosocial adjustment when you get into communities. We also have a large portfolio of health and lifestyle programs that we're evaluating. Of course, Latinos have high risk of cardiovascular disease, diabetes, and other obesity-related issues. So we have several researchers who focus on programs to promote healthy diet and physical activity and the management of chronic disease as well. So those are some of the research programs that we have that are active right now. We are also working to develop some binational collaborations with Mexico so we can kind of understand the transnational impacts on health. And then we are also working to try to develop some collaborations with colleagues in Puerto Rico to extend our portfolio beyond the Mexican-American experience to include other Latino populations in the US.
Great, thank you so much. So on behalf of the University of Texas College of Liberal Arts Development and Public Affairs teams, we want to thank all of the panelists and the attendees for sharing your valuable time with us.